On 30th April, one surprise test is conducted by myself, Dr. Smita Sudarshana, Department of Anatomy, BIMS Papuri.
Don't use abbreviated form like apical lymph node, A lymph node. You should not write that like that. Suprascapular, not to assess, not like that. Always use full form, not abbreviated form. Only 5 minutes is left. Start revision and check your name and roll number should be written on your copy. Only 5 minutes is left.
And questions are like this. First question is, write down extent, deep relation, nerve supply, arterial supply, venous drainage, lymphatic drainage of mammary gland. So a diagrammatic representation of a spread of breast cancer from different quadrants.
You should write like this: extension of mammary gland, the vertical, horizontal, nipple at which region, and the axillary tail of a spines. Now deep relation of breast bed is like this: space, nerve supply of mammary gland, arterial supply, you have to write down this one, and as well superior thoracic, acromiothoracic, lateral thoracic, the branches of axillary artery. Then you have to mention all these: the venous drainage, lymphatic drainage, the mnemonic is same for all. Then axillary lymph node lymphatic drainage in the under the heading of, and we have to mention all these. Now you have to make these quadrants, and from that quadrants the going to the which axillary lymph node you have to mention that, as well as the other lymph node and the additional areas that skin over the breast, nipple, areola is going to where, and the posterior part of the breast. Now you have to show the flow chart from which lymph node is draining to what, and this is for the spread of breast cancer. Diagrammatic representation, and from upper outer quadrant is going to where, then lower outer quadrant, upper inner quadrant, and the lower inner quadrant. You have to write like this.
And second question is, write down extent, parts, branches of axillary artery and make diagram of relation of all three parts of axillary artery. And you have to write down like this: the extent, this underlined, the begins from where and ends at where, and parts, that first part how it is divided by the pectoralis minor. Then branches, you have to mention the from first part only the name, from second part only the tick mark, the thoracoacromial, only the name you have to mention from third part, and these are the branches and the relation of axillary artery. All these three diagrams you have to make. Fourth question is, write down attachment of pectoral and clavipectoral fossa. Mention structure piercing clavipectoral. You have to write down like this: pectoral fossa, these extent are their attachment, superiorly, inferiorly, superolaterally, inferiormedially. Clavipectoral fossa, their attachment, and a structure piercing the clavipectoral fossa. You have to write down all these. And fifth question is, make a neat well level diagram of brachial plexus.
And you have to make like this. Everything should be written in the full form, all the branches, and if there is any initial like this AP, then you have to mention anterior and posterior and the branches from all this, and you have to write down root, trunks, everything should be like this.